In this video, we will review the infection control process for taking alginate impressions. Full PPE must be worn. Plastic barriers should be used to cover the tray table, light handles, as well as the patient chair. Have your impression trays out on the tray table. To prevent cross-contamination, divide your countertop into two spaces with a dirty side and a clean side. It is most convenient to have the dirty side closest to the sink. Set out some paper towels here, as well as a bowl of water, which you will use to smooth out your alginate prior to taking the impression. On the clean side, set out some paper towels and your armamentarium. This includes your alginate canister, 2 clean rubber mixing bowls, 2 clean spatulas, 2 water measuring cups, and finally your measuring scoop. Next, have your alginate and water pre-measured. Remember to fluff the canister before measuring out your powder. After you have measured out your powder and water, close up your alginate canister to prevent contamination. To help you remember which bowl contains the proper amount of powder for the maxillary and mandibular impressions, place the bowls next to their respective water measuring cups. You are now ready to seat your patient. Once your patient is seated, you will want to try in the trays first. Put on gloves and try in both the maxillary and mandibular trays. If the tray does not fit properly, place it into the sink so you know not to use it. Try in a different size until you find one that has a desirable fit. Once you have the trays fitted, begin with the mandibular impression first. Bring the mandibular tray, alginate, water, and spatula over to the dirty side. Prepare to take the impression. The mandibular impression is usually taken first because it's more comfortable for the patient and builds confidence and minimizes the likelihood of gagging for the maxillary impression. After you are finished mixing and loading the tray, set aside your armamentarium, but keep them on the dirty side as they are now contaminated. Once you have finished with the first impression, carefully inspect it to ensure that there are no large voids or any missing teeth. If it is a good impression, rinse it with water and spray it with disinfectant. Remember to use a paper towel as a barrier for the disinfectant spray. Then wrap your impression with a wet paper towel and store this on your dirty side. For the next impression, you will need to put on a new pair of gloves. Be sure to use hand sanitizer whenever you change gloves. Now transfer the maxillary tray, spatula, and the remaining alginate and water to the dirty side, and prepare to take your maxillary impression. Once you are finished with your impressions, dismiss your patient. While wearing gloves, take the wrapped impressions to the classroom so they can be poured up. Scrape the residual alginate from the mixing bowls into the trash. Rinse the bowls, but do not wash any pieces of alginate down the sink. Next, grab the trays that you did not use from the sink and place them in a sterilization pouch and take this to the sterilization area. Remember to label the pouches with the letters DA. Any plastic trays are to be thrown into the trash. Next, with a paper towel as a barrier, grab a few disinfectant wipes to clean all of your items on the dirty side. As each item is being disinfected, place it back onto the clean side. After all of your armamentarium is disinfected, you will switch to your utility gloves to begin breaking down the barriers and disinfecting the unit. As always, use hand sanitizer when switching gloves.